Hello, this is Dr. John Wallman here today with another in the series of Reasons for Calm COVID-19. This episode focuses on the current trends. Is COVID-19 going to end up similar to the flu? This is for April 1st, 2020. So first off, Dr. Fauci in the New England Journal of Medicine on March 26 stated, quote, "If one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%. This suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza, which has a case fatality rate of approximately 0.1%, end quote. That's a pretty significant statement, basically that this is possibly going to end up similar to a bad case of the flu. Well, is that assumption that he's making about if one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, is that a valid assumption? And the answer is yes. And to get that answer stated very clearly, we go to Admiral Brett Giroir. He is an MD and Assistant Secretary of Health for the U.S. Department of Health and Human Services. And more importantly, he's also the point person for testing for President Trump's COVID-19 task force. And he has been stating consistently and repeatedly that the mortality rate for COVID-19 is going to end up between 0.1% and 1%. He stated this in March 3rd, and the reference is given there. He again repeated that on March 28th. And stated not only that the estimate is estimated to be somewhere between 0.1 and 1% by the time we're all done with this, but also that that matches all the models from the CDC. And the references given there, and particularly if you listen to 2.5 minutes to 4.5 minutes where he explains that mortality rate very succinctly. Now, let's put this into a little more context. So the annual average flu mortality rate is 0.1%. And that's something we experience every year and nobody really gets too excited about it. The anticipated COVID-19 mortality rate is going to end up somewhere close to that, between 0.1 and 1%. And I had looked at some models just earlier today where there's a possibility it may end up lower than the flu. So then the next question comes up, well, what about the infection rate? Now, while that is important, it's not as important as the mortality rate. But let's look at that for a moment. The average annual flu infection rate in the US is 10% of the population gets the flu each year. Currently, the COVID-19 infection rate is 0.26%. And this rate is definitely expected to go much higher as we not only get to the peak of the curve, but also then as the testing gets out to start including the people who are asymptomatic or very mildly symptomatic who aren't going to the hospitals. They're not going to the drive-through testing. And up to this point, even if you go to the drive-through testing, you're being turned away because it's being reserved for those people who have symptoms. So if you're asymptomatic, it's relatively hard to get a test. So now if we look at some of the data from other things we've reported before, most people will have mild disease and get better without needing any special care. This is a quote from the Inspector General, World Health Organization on February 28. And from the Journal of the American Medical Association on February 24, current best estimates is that about 81% of people with COVID-19 have mild disease, i.e. undetectable or insignificant. efforts to measure this have ended up with 80 to 86% of people infected will have no or limited symptoms that do not result in a hospital, much less a doctor's office visit. Of those who do go to the hospital, one research report that I gave in an earlier newsletter had that 5% of people who go to the hospital will end up in the ICU. And again, of those who go to the hospital, so not everybody, and 80 to 86% of the people who get this do not go to the hospital. Not only that, or a doctor's office. So it's a fairly small percentage of people who get this that end up going to the hospital. But of those who do go to the hospital, 2.3% of them end up on a respirator. And of those, again, who go to the hospital, 1.4% end up dying. So if we look at those numbers in a little more detail, which I've done in another video, again, it looks like the mortality rate may end up even lower than the flu.